Welcome to Children's National. I'm Aisha Barber. I'm the director of the Pediatric Residency program. What brought me to Children's National was definitely the community of patients that we serve, having such an engaged relationship with the community in Washington, D.C., and also impacting child health globally.
My favorite thing about Children's National is the dedication that we have to the community that we serve.
Children's National is unique among the major hospitals serving children in our country in that it not only is a quaternary care medical center for the children of our nation and the world, but also the primary community hospital for Washington, D.C.
Everyone that I work with in the office is so committed to the patients and the families that we see.
In fact, we take care of more children on Medicaid than any other of the top 10 pediatric medical centers.
I think Children's is a unique institution, especially in this region. It sort of plays both roles as a specialty care center and as a primary care center. You get broad exposure to things that you will never see again in your career, really rare conditions, and you'll be incredibly comfortable with managing common conditions like asthma. A lot of other institutions break up those types of care models. I think here you kind of get it all.
We have a lot of patients here that come globally or have traveled globally, and so the diversity of cases that we see provide a good opportunity for trainees to experience.
I was a resident here, and I was drawn to the unparalleled opportunity to learn from the world's experts in various specialties, while also becoming really competent in general pediatrics.
Children's is a phenomenal place to do residency, and I can say that from personal experience since I was a resident here. There is diversity of patients, diversity of fellow members, and an incredible devotion to education, which means you learn all the time.
This program values the people and helping our residents reach their fullest potential.
Many places can offer a great training program in terms of clinical exposure, which we certainly have here, but we really look to develop each resident individually and holistically.
I think one of the ways that Children's is unique is that we've been able to develop interests in a very strong and broad way.
From focusing on things like global health or advocacy to medical education, we really look to make leaders in the field of pediatrics.
I am really passionate about teaching our residents how to become effective and dedicated advocates and learning alongside our residents in how to incorporate social determinants of health like socioeconomic status and structural racism into our everyday work with our patients.
Washington, D.C. is a really unique city in which to train to be a pediatrician. We have the national government, the local D.C. government.
Our location in D.C. cannot be overlooked. The hospital is literally a metro ride or a bike ride away from Capitol Hill.
We have the National Institutes of Health, the Food and Drug Administration. We have the lobbying arm for the American Academy of Pediatrics located only 12 blocks from Children's National.
There are major inequities in DC, and I think one of the things that has drawn me to not just come back to Children's, but to stay here, is that we can have a tangible impact in DC. As a resident here, you won't be sort of engulfed in this big city, but rather you'll feel like you're actually making an impact in the city on a number of levels.
DC is a majority-minority city. In fact, over 50% of people here in DC self-identify as Black or African American, and another 10 to 11% self-identify as Latino or Hispanic. We want our residency program to have individuals who look and represent the patients that we treat.
When I think of our residents, I think of people who are different from each other with regard to personalities, their approaches, their learning styles, where they're from, and that diversity really is our strength.
My favorite thing about Children's is being able to work with the residents. Just amazing individuals that come together to really work as a team and focus on improving each other throughout their 3 years here.
The residents, the faculty, the leadership, I feel like it's a family. I feel like people look out for each other. Everybody's interested and invested in learning, and that just makes the environment such a positive place to be.
Despite being a big program, we have a small program feel with regard to professional development and support.
One of the really unique things about Children's National is the institutional commitment to mentorship, and that is at all different ages and stages of your training.
My favorite thing about working at Children's actually are the doctors, nurse practitioners, nurses, everybody I've worked with here over the last 20 plus years. It's an amazing camaraderie I didn't see before I came here.
Well, here you will be surrounded by people who really care about you and want the best for you. And you'll graduate from here feeling competent and confident in whatever specialty or general pediatrics or global health or non-clinical care that you decide to go into.
You're going to walk out of this residency program brilliantly well prepared to be a general pediatrician in the community or to enter a subspecialty fellowship program.
I hope that students will consider training at Children's National because of the people that we care for and that we work with, our diversity and focus on health equity and inclusion, our educational innovations, as well as the personal approach to professional development that we provide. Be yourself and bring yourself to the table and really look in programs for the things that are important to you and where you would like to see yourself being a colleague with the people that you're interviewing with.